Good afternoon. First of all, let me just say Sheila Jackson Lee. I serve on the COVID-19 bipartisan task force for the House of Representatives, and we'll be in a lot of meetings over the next couple of days. There was a White House briefing today as well, more or less indicating our commitment to the rapid tests to be utilized at home. We are expecting and hope that we will receive as soon as possible a 500,000 to be distributed throughout the United States. We think that is a very important element. But I also spoke to the Texas Department of Health Services on just where we are, and I thought it was important before I start to also provide the fact that there are 8,000 persons taking up beds in the hospitals in Texas, and it is, or we may be at a point when we'll have no beds for cancer victims, heart disease, stroke victims, children with appendicitis, other medical needs. I think you're aware that FEMA will be setting up testing sites, but we are now sending to hospitals, and there will be more coming, because I don't think we're going to be able to suffice with what we've been allotted, and that is medical teams from the military to be able to help hospitals who cannot handle any more patients because of staffing. We have a unique situation now, even more unique than when we first started 2 years ago, that Omicron has such a high level of transmissibility that our medical teams, our nurses, our janitors, our food service workers in hospitals, our support team are also getting tested positive, and we're losing staff. So it is going to be very important that we have a support staff. One of the things that was discussed with me that I want to report is that being fully vaccinated is not 2 vaccines. And I hope to speak with the Centers for Disease Control to make that clear. Fully vaccinated is getting the booster as well. There are, I believe, 7 million that are here in this state that are not fully vaccinated, meaning they do not have booster shots. With that in mind, I want to first acknowledge that it is important for everyone to get booster shots. And so as you're getting tested, don't stop getting the vaccines, which are free and plentiful. Please go and get your booster shot. While we are doing the testing, Butler Stadium was open today. I will be doing a testing and vaccination at the Northeast Command Station tomorrow in Northeast Houston with the Houston Police Department. And I'll be doing another testing and vaccination far out north on Saturday, and that is January the 8th. I will try to continue to do the outreach. With that in mind, it disturbed me greatly when Keith Downey, the president of Super Neighborhood, representing this area, the Cashmere, Kelly neighborhood, and former council member Carol Galloway, who has still not been able to get tested, indicated that they had utilized seemingly pop-up type facilities. We perceive this to be a national issue. That is why I'm doing this on the way back to Washington. And so, even though we have determined that this red facility, this trailer, may have legitimacy, there are problems that we need to fix. When people are desperate, they need to have the facts, and they need to get them as quickly as they possibly can. We know there have been some delays between 3 and 7 days, but there are some fractions going on, and I believe this is a national issue. So I have sent letters These sites are not only at the corner of Kelly and Hirsch. My office has received calls from individuals far out in Harris County, some in my congressional district, some not, some in the Cypress area, some in the Humble area where there are pop-ups, some in Southwest Houston, that there are pop-ups. They are charging $100 and then processing. We've got to get a handle on this. So I've asked Director of the FBI, Christopher Wray, to look into it from a national perspective as we go into this very intense season. My letter reads, several reports of pop-up testing sites across Houston have been brought to my attention. These sites primarily target low-income or non-native individuals and require payment upfront for testing. However, these testing sites fail to provide results in a timely manner, if results are provided at all. One site reportedly only provided testing results after 7 days, and numerous contact attempts by local media. Now, one of the issues is this should be a medical issue. You should be tested, and the provider should provide you with a backup phone number, a troubleshooting number, and none of that is seemingly occurring when you're doing facilities that are pop-up around the community. Most of the people getting tested may be desperate. They may even have symptoms. And so they have symptoms and they can't get an answer. That's what's so tragic. They may also be paying. Let me be very clear. Vaccines are free. This is from the federal government, the United States government. That's why 500,000 tests, the rapid tests, are being sent out as soon as we receive them. And so my point is, this issue is exacerbated by the fact that the contact information provided by these sites, including telephone and email addresses, are often disconnected or incorrect. So I've asked Christopher Wray, as well as the special agent in charge, the acting agent here in Houston, to engage in an investigation. I hope that I'll be speaking to them, and I hope that they will set up a number, a troubleshooting number, that individuals who have not received their results within a timely basis, and they have tested outside of the governmental standard testing facilities. We've tested at schools. We'll be at a police station. We'll probably be at a hospital or a parking lot. These are where you can at least have a place to go with a complaint, or a place to go where you have not gotten your test. But when you have facilities that are pop-ups, it is very difficult to get through. So this is a federal matter. These are federal dollars, and I've asked to investigate if there's any misconduct. Today, I am not alleging misconduct. I am alleging that the calls are coming in and that people are being, in essence, people are being denied their results. They have to go to school, they have to go to work, they have to protect their family members. This is serious. And the Omicron is going to be with us at least through January and February. We'll be peaking. And so this is clearly an issue. The letter goes on to say any potential misconduct relating to COVID-19 testing and vaccination must be addressed at this time when Houston is we're one of the cities with the largest surge. Texas is one of the cities with the largest, it's at a red level, largest number of cases. And so we're asking them to immediately engage in this review and investigation. Again, I'm going to ask them to set up a number. I think there should be a national number. I have sent this also to the Texas Department of State and Health Services. I spoke to the head of that agency. They do not have direct jurisdiction, but they have responsibility for health care of Texans, and they are very interested, and they too will be looking at this. I have also written and will be engaged with Secretary Basara of Health and Human Services. This comes under his agency, and I want him to be involved as well. So I want to first hear from former council member Carol Galloway, who lives in the area, for her to give her experience, and then I will come back. We'll have another speaker, and I will then open up for questions. Council member, thank you very much for your leadership and trying to protect your neighbors. Thank you.
Good afternoon. I was very disturbed when I did not receive my results. I still have not received them. It's been past 7 days. They gave me a contact to call the lab. No response from them. Couldn't get through. And that's when my bulldog came into me. I had to try to notify the public to let them know what was going on because it's very important. I want to know because I have great grandkids that live with me. And I want to monitor to make sure I don't get the virus or anything from them. So that's the reason I contact Channel 13 in regards to this. The young lady came out, did some investigation. She even went to the lab and found out that me and my family was not even in the system that took the test. Something is wrong with that problem. We weren't in the system of the laboratory. So I still have not gotten my results. I'm very disappointed, and that's the reason I contact my Congresswoman because I knew that these was federal dollars that they were getting, and I didn't want any fraudulent in this community, so I wanted to bring attention to my community for their health's sake. And I thank the Congresswoman. I really appreciate all the work that she does in representing us. Thank you.
So was that this location where you got tested?
Yes, at this location. That's correct.
And you're now going back to, where are you trying to go to? You haven't been tested yet.
No, I haven't been tested yet. But hopefully I'm not asymptomatic. So that's the reason I'm staying my distance. Thank you.
Councilmember Carol Galloway. And then I would like to have Keith Downey. I want to thank him for his leadership. He heads the super neighborhood. He is a champion of the Cashmere Garden area. We're at Kelly and Hurst, which seems to be a very busy corner. And Northeast Houston, we work together. Keith Downey. Tell your whole story.
Thank you, Congresswoman. Thank you for coming out here to our community. Thank you to Ms. Galloway as well for putting a spotlight on darkness of what's happening out here. So my story is, I've been tested ever since I got the first vaccine because something told me with common sense that I did not want to get it even if I was around a group of people. So every time I've gotten the vaccine, I've gotten tested periodically along the way. That being said, fast forward to the Christmas break. I happened to make an appointment at another facility blocks from here, and is a respectable site. And I got those results within 48 hours, about 30 hours. It said negative. But when I tested over there, I happened to be driving down Kelly, and I said, another testing facility. And I said, let me stop in, and I don't want to lead people if I don't try it myself. And so I tried this facility, and that was on the 26th of December. Okay, Mr. Downer, you'll get your results in 1 to 2 days. I got my results January 1st at 8:20 in the morning in an email. Now, I was negative there. 10 minutes later, I tested here, and this place said positive. All right, PCR test. I've subsequently tested at the respectable site, and I've gotten another negative. So our community and the residents, they depend on these sites in the community. They don't have transportation to get out to a lot of these mega sites. So they depend on respectable organizations and places that are offering the test that can help us where we can't get out to another test. And it's affected our community with COVID and Omicron. Also, make sure when you're getting a test or you're getting a vaccine, it's with a company that you can research, a company that you can call a phone number if need be, but make sure you follow up if you don't hear something in a respectable amount of time. Set expectations with people and follow up, because these are your test results. Thank you.
And what you said something about midnight?
And I'm looking at the letter, and it says the specimen was taken 12/28/00. That's 12 midnight exactly on the nose. Okay? I gave it on the 26th. I received it in an email on the 1st of January at 8:20 in the morning because I made sure I studied that last night. And so it's important. Make sure you're knowing who you're dealing with and being able to follow up if need be with these organizations and these companies and these testing labs. Thank you.
Did you test again?
I've tested since and it's negative.
And where did you test?
Test at Curative right here at Cashmere Kiosk. And that's where I normally test. Mm-hmm.
So let me indicate to you what we've discovered in my office in Washington. In Philadelphia, the Philadelphia Department of Health is warning residents to beware of another potential pandemic-related scam. Philadelphia health officials sent out a notice yesterday afternoon saying they caught wind of small pop-up tents offering free COVID testing in Center City. Their staffers were allegedly lying about what agency they're from and requesting an unusual amount of information from the various persons trying to get tested. St. Louis, authorities and residents report fraudulent testing sites in which the operators collected personal patient information but sometimes didn't provide test results and other times operated at sites without permission. In one case, police shut down an operator that was asking residents for their Social Security. In San Antonio Health Department is warning against fake testing sites. These fake sites require a high level of patient information. Local officials say they don't have a way of knowing where the information collected is going. That's why the FBI needs to be involved. In Chicago, officials in Illinois are cautioning against fly-by-night testing sites appearing in the greater Chicago area. These testing sites request $70 upfront credit and information and Social Security. When I did testing on last Wednesday and Thursday, we had individuals who left a site that was asking for $100 and I think $150 for processing of a test. I view this as a national issue that will intensify as people become more desperate. The lines, because we're opening more sites, thank goodness, the wait is not as long. But as this Omicron spikes and people who are boosted don't get the booster shots, which is what is really a complete vaccination, then it will spread and have breakthrough even with vaccinated persons. And so it is extremely important that we stop these pop-up sites that are not legitimate, and it's extremely important that the FBI, Department of Justice, takes a look working with local police authorities. Again, these are federal funds, and they are free. The vaccines are free, and the testing should be and is free. With that in mind, I'll open it up for any questions. Let me thank Mr. Downey for being a community leader, and thank Councilmember Galloway, who's always serving. Yes.
Congresswoman, I brought this to your attention last Wednesday at a different testing site. I understand that you're reaching out to the FBI to handle this on a national level, but it is still very much a state issue, being that the state does not regulate sites like this one. What do you think needs to be done here in Texas now?
Well, I think the state can state policies that indicate beware of pop-up sites. Beware of giving extraordinary information. As indicated when we spoke, your cell number, your name, your possible date of birth, and a phone number is what is needed in order for the information to come about your results. Social Security numbers and other things that are more personal are not needed. So you should be cautious of that. The state can provide information. The FBI is the legal arm of the federal government when the federal government is being defrauded. The federal government is being defrauded It could be civilly or criminally when they have a place that is standing up to use federal resources to provide for the community and they don't get it. And the question is, what is happening to the federal resources? What is happening to the product? Is the product being used right as well? So I think what can be two-pronged response that I'd like to see. I'd like to see all of the local authorities, from the county to the city, the health departments, recognizing that this is a problem, and just sending out information for the consumers to beware. They're all eager to get tested now. They're all frightened. They're all requiring to get tested. If they can't get tested at their schools, then they're going somewhere else as good parents. I do want to emphasize to them, the best thing you can do is get vaccinated and tested. And then with respect to the investigation, I do want the FBI to take a look at whatever's appropriate under their authority, any allegations made about a pop-up center. The best thing for them to do would be to set up a number or to give the number that can be utilized so that the nation, I've just called off Philadelphia, St. Louis, San Antonio, Chicago, as clear examples where the health departments have been trying to stop people from going to these pop-up centers. We now need to have some authority that will come about from the federal government law enforcement arm.
Are you aware of people complaining about getting late results or results from other people at the UMMC site?
I know that in every site there is delay, but delay is not the issue. The real issue is, can you follow up? Can you have a place to go? There is a backlog everywhere. There's a backlog at curative. There's a backlog everywhere.
What about them getting results from other people? Results that weren't theirs?
Those are few and far in between, I'm sure. Those should be corrected, no doubt. But that is not a circumstance where you're not at a site that is legitimate, that you can make your complaint and or to fix what the issue may be. That's happening everywhere. We're speaking specifically of if people are going to sites that really do not exist. They're not there for that purpose. We want people to be able to go to sites that if there is an error, in that error they can get it fixed. And that's happening to all of the sites, but people can go there and get them fixed. Two different things. Yes.
I just want to clarify. So you're specifically calling the FBI, or calling on the FBI, to investigate how to regulate sites that pop up claiming to offer, whether it's free or not free COVID-19 tests, and it's how people can call if there is a problem regarding legitimacy of that site. Is that correct?
Now, I'm calling on the FBI to assess the national threat that pop-up sites may provide. They have evidence now from at least the 4 places that I've said. We have information from this area. And so it is appropriate for the FBI to determine if any laws have been violated by these sites and what should be the next steps. They are an investigatory arm, and they provide the information. It then goes to the DOJ or the local U.S. attorneys. So I want this to be as serious an issue that will allow them, and they can decide whether they put forward a number or they tell individuals to talk to their state health authorities, and the information comes from them. But the only persons that can determine whether or not the information has been used, the only persons that can determine whether or not there is something wrong and that their resources used wrongly will be an investigatory arm. This is not prosecution, this is not indictment, but it is getting at the facts. I am really going to continue to gather information of these sites around the nation. But I already think we have a substantial amount that suggests, because testing is so easy to do, relatively speaking, in terms of masquerading, if you're not real, that you're doing a test and that you're not getting any results, or you're getting mixed results, if you will, then I think it's appropriate to make sure that we protect the public. That's all I want to do, is see the public protected. If there's an error, there's always going to be an error. I hate to say there's going to be an error in a medical office, there's going to be an error in hospitals across America, but you have a place to make your complaint. You have a place to correct what may have been an error. An error is not criminal. An error does not make you liable. But what makes you liable is the fact that you set up a site, you're not there, you are not giving out correct information, and you're not only in Houston, you're across the nation. Let's stop this across the nation. That's really the challenge.
Congresswoman, what's the biggest issue right now? You're calling this a national issue. What's the biggest threat in your eyes? Is it, for the public at least, is it losing personal information? Is it not getting results in 2 weeks and then possibly infecting others, getting false results, and being around the public and spreading the virus? In your eyes, what's the biggest national
I think the two
threat?
distinct, one is life-saving. If you do not have information correct and timely, then you could be transmitting. So timeliness is important.
And what should people do that have now been waiting 2 weeks, like the Congresswoman, like the Councilwoman, who have been waiting for 2 weeks? What should they do if they're still waiting? What's the next step?
Well, let me give the second concern that I have is the utilization of private information, such as a Social Security number. I think that is really a challenge as well. Social Security numbers are for poor people, working people, middle-class people, rich people, but when you get a Social Security number, you can damage the individual. What people should do is try to go to another site to get the most important thing for them and their health is to know whether they're negative or positive. Certainly, I would prefer them going, if they have symptoms, I believe, and that's public symptoms of coughing, a fever, they should quarantine. Probably should not be out and about trying to find a testing site. But I am not a doctor. So I would say to them the ultimate thing they should try and do is talk to a provider as to whether they should still seek to have a test or that they should just quarantine because they have symptoms.
You mentioned a number of cities where fraudulent behavior is taking place. Could you talk about the loophole, how trailers like this that don't have a phone number, don't have a lab, don't have anything for people to go back to, are finding ways to, I guess, benefit from the federal government and their resources?
Because this is America. We're not a place where we are walking with law enforcement attacking or shutting down entrepreneurs, if you will. And they're taking advantage of the fact that people are in need. And they're finding access, maybe in a good way. I think that's what has to be investigated, to these tests, and people are in need. Look where we are. Look where we are. We're in communities that are vulnerable. And sometimes they're in far places in the county. And that's an easy place to take advantage of. But as we can see, Philadelphia is talking about Center City, Chicago in the city, St. Louis. So it could be vulnerable communities, urban areas, rural areas, taking advantage where people are in need, maybe where elderly are. And as Mr. Downey said, it is difficult for neighborhoods like this to get to some of the mega sites. So they are a place of convenience. They seem to be like a Good Samaritan, a place of convenience. I don't want to stop Good Samaritans. I don't want to stop people who are legitimate, a doctor who comes and says, I'm going to do it out of my office. But if you do that, you must have a place where the phone does answer. And you can get a response if they don't get their test within a timely time or there's anything that needs to be corrected. That's the distinction. The pop-up sites are just what they say. Pop up and gone. Or pop up, no answers. Or pop up with the wrong information. I want to see the public protected. And whether it's vaccines or testing, I want them to be protected. So,
about this or another, is the city health department, who would you complain to about the unresponsiveness on the part of a pop-up unit like this to alert local officials? Do you have any idea who?
well, you can certainly alert your elected officials, and without presupposing what the Harris County Health Department could do or the city health department could do, they are burdened by trying to get people legitimately tested. But information to them, and they have a website. There's a 311 number and a 211 number. My understanding as a member of Congress, I want to make sure I get the numbers correct, that people could provide information to. I encourage you to realize certain facts. If they're asking for more information than your cell number, your name, and possibly your date of birth, then you have to question why you're being asked so much. You need to also question the viability of pop-up places that may be here for a day or two and close. The lines are long. We're trying to make them shorter. We're opening more sites. I had long lines, but we took care of every single person on last Wednesday and Thursday. We'll be open again tomorrow and open again on Saturday. But in the meantime, there are a lot of sites that are being put forward by the health department of the city and the health department of Harris County. Our city and county health departments have been working very hard. But I also think the state should be aware of what's going on, and I've made them aware of that. I've already spoken to them. And the state can work with local authorities to make them aware that they should be very alert and sensitive to what is happening to the public. So I'm very grateful to all of you at this moment. Let's just try to, my message is this: get all the information you can. Be very cautious as where you give your own private information. But because this is a life or death matter in terms of who you can transmit to, take your testing very seriously. And as unpleasant as it might be, wait in a long line if you can get there. If you're in communities like where we are, utilize your multi-service centers, which is Northeast has one, Cashmere Multi-Service Center, and some of the ones that have been set up under the auspices of your local health departments. That is the best way to do, or to call and find out what is near you. We're also working with houses of worship to take testing to a number of houses of worship in neighborhoods, and we will continue to do that. Saving lives and protecting the public has to be our chief responsibility in the middle of Omicron, which is so highly infectious. And finally, get your booster shot. That's when you're completely vaccinated. And get the children 5 to 11. I didn't mention, and I think it's been said over and over again, the Texas Children's Hospital makes national news because of so many children in the hospital because they were unvaccinated. Obviously, they may be very young, or their parents just were not able to get them vaccinated. We must take caution to save lives.